Hello everyone, I am Dr. Gautam Banga. I am a reconstructive urologist and neurologist working in Delhi NCR. And we have always heard the phrase healthy mind stays in a healthy body. So if we want our mind to work good, our body should work in sync and it should be in a healthy shape and we should work for that. This is a time we have to be very careful. We have to look for the ways by which we can keep ourselves healthy because health is the new wealth. Or in fact, health is the wealth. So let's talk about how we can keep ourselves healthy, how and by ways by which we can improve our health. And if our bodies, if we have a healthy body, then only our mind can be stress free and we can work to best of our potential. So let's pledge to make ourselves healthy and keep ourselves in shape and stay fit and be healthy is the motto for the month. So let's
Welcome to
start
Shruti.
discussing one of the health topics, and that is urethral strictures and what is urethral stricture and how we can take care of it.
Welcome to Shruti Outloud, a podcast where I invite guests from different walks of life to share their stories of following their passion, success, and happiness, which in turn motivates our listeners to follow their heart. Hello and welcome back to Shruti Outloud podcast. So, as you all know, we have dedicated the month of April, the series of April, to health and wellness. And the name of the series is Mindful Body, Soulful Life. So, welcome to this episode, and where we will be exploring topics. And in the whole series itself, we are exploring topics related to health and wellness. And in today's episode, we have a very special guest, Dr. Gautam Banga, who is an andrologist. Um, so, urethroplasty is a surgical procedure used to treat urethral strictures, which can cause discomfort and even difficulty urinating. So, we are going to dive deep into this topic today and learn more about the procedure, the benefits, and what to expect if you are considering undergoing it. So, let's welcome our guest and start this conversation.
Hello, Shruti, how are
Hello,
you?
Dr. Banga. I'm good. How are you?
And it's a pleasure being the part of this Health Awareness Month, which you have just started. It's a good initiative, and we should all advise as well as work for a healthy life, healthy mind, and healthy soul. So, since you have raised the topic of urethral stricture, so it sounds very scientific kind of a word, urethral stricture, but that's something which is
Right.
very common. Okay, so it's just surgery, but the symptoms, most important that the people should understand what urethral stricture is and what are the main symptoms, what are the signs which are there, and how a patient can come to know that he's might be having a stricture and how he can get itself corrected and get it corrected and whom to approach. So urethral stricture is, so we all have a bladder and there is a urine pipe which drains the urine from the bladder out of the body. So that pipe is known as urethra. Okay, so urethra is there in both male and female. So urethral stricture is not a male problem; it's a problem of both male and female. And due to some reason, if that urine pipe become narrow, okay, or if there is any injury to that urethra or the urine pipe, the patient start facing problem in passing urine. Okay, so he can have a very thin stream of urine, or he or she might have to strain to pass urine. And in severe condition, the urine can completely get blocked. So the patient want to pass urine, but he or she will not be able to pass urine. So that condition where the urine pipe or the urethra get narrowed or blocked is known as urethral stricture, and it is one of the very few emergencies being a reconstructive urologist. So when you introduce me as an andrologist, but I am andrologist as well as a reconstructive urologist. So for reconstructive urologist, it's one of the emergency, and we need to act fast in that condition. So that is all about urethral stricture, and well, stricture can happen with multiple reasons. Okay, so most commonly nowadays in present scenario, the urethral stricture can be because of if the patient has been introduce a catheter, a urine pipe, to empty the bladder, either during some surgery, or if the patient was having some other medical issues, and if the pipe has been placed. So that is one of the most common causes. In the past, it used to be urine infection, when we didn't have much of antibiotics. So at that time, because of the recurrent infection, the urine pipe used to get damaged, and it used to heal by scarring, so tight stricture. And so, but now the infection rate has come down, and because we have good antibiotics, other medicine, so infection doesn't cause that much of a damage. And the third most common cause is instrumentation. So if somebody has gone through some prostate surgery or some scopy of the urine passage, so these are the main causes by which stricture can occur. Urethral injury can also present as stricture. So any road traffic accident with injury to the pelvic region, or any blood injury to the perineum, that is the part through which the urine passage passes. If there is injury to that region, so that can cause urethral stricture.
Dr. Banga, how common is it and who is most at risk of developing it? Like you mentioned all the causes and all, but I would still like to ask you if you could maybe, define that part. And also, I would like to know how common it actually is.
So Shruti, very difficult to talk on the lines of percentage, that how many people out of the population will get affected. But I have seen there's an increase in the incidence. Is either because of frequent catheterization, that the urine pipe is placed, or there's because many of them are driving two wheelers. So number of people who are driving two wheelers have increased tremendously. So all these people are slightly more prone for injury to urethra if they meet road traffic accident, because they are not sitting in a closed four wheeler, but they are on a two wheeler, which can skid, and that can cause amount of blood trauma to that region, or even a pelvic fracture. So two wheelers, the people who drive two wheelers, ride two wheelers, are more prone, if they meet an accident, they're more prone for urethral injury or trauma to the urethra. Otherwise, anybody who is having recurrent urinary infection, multiple time instrumentation, that they are going for multiple scopies, or anybody and old age group, if we talk about them, then the patient who have been operated for prostate surgery, who operated for prostate through endoscopic surgery. So these are the patient who are more prone for urethral stricture. Coming to females, urethral stricture was very uncommon, considered very uncommon in the past, and most of the time the problems of female were labeled for the to the hormonal imbalance. But now, since we are giving up like a different focus to the female health, and now we are seeing more and more female patients with defined urethral strictures who need proper care as well as surgery to amend the problem.
Doctor, what are some of the symptoms of urethral stricture and how can it be diagnosed?
Okay, yeah. So as I said, the urethral stricture is a narrowing of the urine passage. So naturally, if the thing is narrowed down, so patient will note that the stream, like if he was able to pass urine with a very good stream going around almost like a meter away from him, now he'll not be able to pass urine with a very thick, bold stream. The stream is very thin, a narrow stream, might be going a distance, but it's very narrow. If it's a severe narrowing, patient will not be able to even generate a stream. He will be able to pass, he or she will be passing urine in drops, or stream which breaks very often, and patient can have complete blockage of the urine. He can have recurrent burning, like he will complain that every time he try to pass urine, there is severe burning sensation or pain in the urine passage. He can have pain in the lower abdomen because the bladder stays full most of the time. I've seen patient having stricture for long coming to us with complete kidney failure also. So because since he's not passing urine completely, the bladder is full most of the time. and because of the fullness of the bladder, there's a back pressure to the kidney, and eventually the kidney start failing or decreasing in their function. So I've seen people coming to us with the stricture, and along with that, a very uh, badly affected bladder, as well as kidneys which are not functioning even 20% of the normal. So
Yeah,
the
I
second,
think.
coming to Shruti's second question, sorry, I'm
Right.
going slightly
No
up and down. So
worries.
the thing is
Yeah.
that if the patient note these kind of symptoms, they should approach the urologist, because he's the right person to check whether what kind of symptoms they are having and what next need to be done. And there are various ways by which we can come to know about whether the patient is having stricture. So we do a uroflowmetry. So that is a graph pattern in which we check how the urine flow is, and there are very specific types of flow pattern which helps us in knowing whether the patient is having stricture or no. Then we do an ultrasound to see how the kidneys are, whether the bladder is of good size, or whether the bladder is emptying completely or no. And once we feel that the patient can have a stricture, then the you can say the gold standard of knowing the thing is an radiological study, which is known as retrograde urethrogram. So in that we pass dye through the urine tip of the urine pipe upward, and that give us a pictorial or an X-ray of that thing, give us an idea whether there's any blockage and how long the blockage is.
Right. Okay, so doctor, could you tell us what is urethroplasty and how is it different from other treatments for urethral strictures?
So urethroplasty is the what you can say the best the treatment which gives the best result, and is there since early 1900. Well, it changes. There is always a change in the way we do the surgery, and now in most of the cases we don't uh, cut the urethra, or we don't remove the urethra. We augment the urethra. So there are various other ways by which a stricture can be managed, but none of them have the success rate even closer to even 50% of what the urethroplasty can offer. So earlier, people used to dilate the stricture blindly. They used to pass metal sounds. There used to be an instrument, metallic instrument of different sizes, and they used to try to push it down the urethra, which is very barbaric kind of thing. But yes, in the past, it was used to correct the blockage. So it's like cleaning the any kind of a metallic pipe. You have to push it and try to remove all the thing which is stucking inside. Then came the endoscopic treatment, which is still in use. People do, and in very short segment stricture. If the segment stricture is very short, very flimsy, not very dense, we can put a scope inside, and that can be done either with a knife or a laser. And it is useful in say of people come with this problem. Only one or two can actually get benefit out of it. So urethroplasty, again, the gold standard and the best treatment modality to correct any kind of urethral injury or stricture you can have, and almost close to 90% success rate.
Doctor, could you tell me the benefits of urethroplasty over other treatments such as urethral dilation or urethrotomy?
Yeah, very good question, because it's a very valid question, and people always get confused whether to go ahead with the urethroplasty, why to opt for urethroplasty. So, as I said earlier, this is the standard of care now. So, if we want a treatment which is close to 100% or which is permanent, then the urethroplasty is the best choice or best option. Anything like if we do endoscopic intervention and we try to cut the thing, we have to understand one principle of healing in the body: a scar heals by a scar. So until unless we put something to bridge that scar, or we put something in between the scar so that scar doesn't contract, that's the thing only which can give us a permanent opening of the passage. So urethroplasty work by that. So we put various mucosal layers inside. So we can take mucosa from inside the mouth, We can take from the a piece of mucosa from the tongue or lip, and we can use it to bridge that scarred area, and so there is no contraction and the urethra stays patent. So urethroplasty, gold standard, and if anyone, any patient, any person is having a stricture, they can try endoscopic intervention. If it's a short segment stricture, not even a centimeter of a stricture, they can try endoscopic laser intervention. But if they have a long stricture, a stricture because or no narrowing because of the trauma, don't think of going for shorter or a simpler version of treatment, which is endoscopic treatment. Opt for eutroplasty. The results are fantastic and very close to permanent solution. Very close to.
Right. Doctor, how long does this procedure usually take, and what is the recovery period that we are looking at once the procedure is done?
Yeah, so most of the time when the patient comes to my OPD, the question is, Doctor, for how long the surgery will last? So I'll tell them, okay, surgery is, I'm the one who's going to do the surgery. I'm the one who's going to get tired. Your patient will be sleeping all the time. So don't worry about the time, whether it's 2 hours, 2.5 hours. But an usual, so, but naturally, that's a concern, and I have to answer that. So a normal urethroplasty procedure can last from 1 hour 30 minutes to a difficult one can last for even 3 to 4 hours. So time is between 1.5 hours, 2.5 hours most of the time, and that's the time in most of the in which we are able to complete most of the urethroplasties. We keep patient for 2 days in hospital. That is somewhere around 48 hours. We change the dressing once after 48 hours of surgery. A catheter will be there for 3 to 4 weeks, depending on the type of the stricture we have operated, whether it's a short segment or long segment. But the catheter will be there for three. Catheter is the thing which is to drain the urine out of the bladder, and a bag will be there attached to that, and it will be there for 3 to 4 weeks. And once the catheter is out, patient can do all their routine activities. Even with the catheter, after 7 days, they can take a shower, they can move around, and if they don't feel shy or don't feel conscious carrying a bag along with them, even they can go to the nearest park for a stroll, and they can go out with their pets in the morning for a morning walk.
Thank you for answering this question because yeah, I think that is this is one of the main concerns of anybody who is going for a surgery, that how long is it going to take? And although obviously they are most of the time they are just lying there as you just said, but yes, that thing is in everybody's head कि अच्छा कितना time लगने वाला है.
I think more important, the patient is not worried. The attendants, the patient's attendant, they actually are more concerned about the patient, and they just want to know because they normally categorize surgery as minor, major, super major, depending on the duration of the surgery, not the way it is done or the skill involved in that.
So true.
That way.
So true. So true. Absolutely. Okay, so doctor, what are some potential risks or complications that are associated with urethroplasty and how can they be managed?
So, Shruti, it's an elective surgery. It's not an emergency surgery. So, we do a full workup of the patient. We do run all the blood tests. We do all, if it's a elderly male or a female, we do cardiac evaluation, complete cardiac evaluation. We do a pre-nacid checkup. We have a full team of physician, or most of the hospital have physician and intensive care. So the risk factor involved in this surgery is bare minimal, very minimal kind of thing. So it's a very safe surgery done under either regional, that is a spinal anesthesia, in which half of the body is anesthetized, or a general anesthesia. And the moment surgery is over, patients are back in the, they can talk, they can interact with the attendants and relative. So any big surgery have a 1% chance of excessive bleeding or infection or some anesthesia risk, and these problem can easily be managed. So overall, very safe surgery, not much intra or post-op complications involved, and patient, as I said, patient can go home after 48 hours. Even if the patient is in a hurry, we can send him even within 24 hours home. So very safe surgery, nothing to worry about it when it comes to pre-operative, intraoperative, and post-operative complications.
All right. Okay, so doctor, are there any lifestyle changes or precautions that patients should take after undergoing the surgery?
So after surgery, once the catheter is out, patient can do their routine activity. We tell them not to ride a two-wheeler for 2 months because it actually put a lot of compression to the operated site. And we don't. We always tell them not to sit on a hard surface for some time. They can resume just their sexual activity after 2 or 3 weeks after removal of the catheter. So, if we, in a nutshell, if we see that the patient can become normal, completely normal, say after two months of surgery, and they can do whatever they were doing prior to the procedure. Not much precautions are required just after removal of the catheter, but yes, they should be careful that they should not get multiple, or they should take all the precaution not to get any urinary infection, because any kind of infection in the urine can affect the mucosa which we place inside and can lead to damage of that mucosa. So the only thing they have to look forward is that they should be more careful when they do the sexual act, and infection should not happen. And if they're planning for any kind of instrumentation in future, they should inform the doctor that urethroplasty have been done. So the person who will be doing the instrumentation will be more careful dealing with that part of the urethra.
Okay, so doctor, is this can urethroplasty be used to treat recurrent urethral strictures, or is it a one-time solution?
As I said, that urethroplasty is something which can give the best results when it's come to treatment of stricture urethra. If one urethroplasty fail, we can always do a second urethroplasty. As I said, it's not 100%. No, nothing is in this world 100%. So the success rate of urethroplasty is somewhere around 90%. So in 10% of patients, there can be a failure, and in most of these patients, it can be managed by repeat urethroplasty. Okay, and there are few cases in which the urethral damage is so much in the first go that we have to do correction in two stages. So that is known as two-stage or a multi-stage urethroplasty, in which first we open up the urethra and we let it heal on its own. And in the after 4 or 6 months, when all the infection, all the swelling and inflammation is taken care of and gone, it's done, we close the urethra, and the patient can pass urine from the tip of the penis, or can pass urine in a normal way. So most of the time, urethroplasty can be done in one stage, but in certain cases in which there is very severe damage to the urinary pipe or urethra, in such cases we have to resort to two-stage or even sometimes three-stage urethroplasty.
All right. Okay, Dr. Banga, thank you so much for picking up this topic and answering all these questions. I think, yeah, this episode is definitely going to help people understand what exactly is it and what is it that they can expect. And as you mentioned that, it is a safe surgery. And yes, like you mentioned all the things that I think people who might be thinking about it should know. So thank you so much for taking out time and answering all the questions that I had.
Yeah, thanks a lot, Shruti, and it's nice. So I just want to summarize in two lines that if anybody is having urinary symptoms, don't try to take pills on your own. Uh, yes, we all know antibiotics nowadays. Everything is there on the internet. But in spite of taking on your own, try to reach to the nearest urologist or even a surgeon or a physician. Go and meet him or her, talk about your symptoms, and sometimes this thing can be missed if you are taking medicine on your own. So self medication is good sometime when when there is no doctor around, but it's better to consult a doctor because he's the expert and he can help you in a better way.
Thank you for that advice. And I think, yes, it is very important to understand that take some things you should, pay attention to and go and see a doctor. Absolutely. All right, Dr. Banga, thank you so much. And I also would like to thank our audience for tuning into Mindful Body, Soulful Life. And we truly hope that today's episode has provided our audience with a very valuable insights and understanding into urethroplasty, a surgical procedure that is used to treat urethral strictures. And if you're someone who is considering undergoing this surgery, we encourage you to seek out the advice of a qualified and experienced doctor like Dr. Banga. And we are very thankful for him to take out time and have this conversation with us. And as always, we'll be back with more tips and insights on how to live a healthy and fulfilling life. Thank you so much, Doctor. Shruti Outloud welcomes all stories. It can be a brand, it can be an organization, or it can be a person. The only thing common would be passion for life. Please subscribe to this podcast on Spotify, Google Podcast, Apple Podcast, Amazon Music, Ghana Podcast, and every other platform where you can hear this. Please leave a review as that helps my podcast to grow. Thank you once again. See you for the next episode. Bye.